Welcome back. This section of the show is called Ask FPA, or Family Practice Associates. If you have a question, you can send it to tv@fpalex.com. Include your name if you'd like for us to use it on the air. The question tonight is, how do I recognize if I'm depressed? And the person didn't leave their name on that one. My guest to help answer that is our family therapist at Family Practice Associate, Mr. Raleigh Kincaid. A lot of people don't like to talk about depression. No. They just don't really like to mention that. Sometimes you know, sometimes you don't.
I would say, I think that's true. I think most often you don't really know, or you don't want to put the name on it, you don't want to put the label on it. You know you don't feel right, you don't feel good, but you'd have to have pretty good cognitive processes to know to put the label of depression on it. And of course, when you're depressed, your cognitive processes are impaired. So yeah, you may not even really recognize that you, or at least name it as depression.
And you can be depressed. I mean, your dog dies, you have a death in the family, but sometimes you can just be depressed.
Yeah, I mean, there's a little bit of a difference between depression and depressed feelings. And depressed feelings can come from situations, something of grief, something happens, and you feel depressed. And then depression is more deeper. It's clinical. It's usually requires medication to fix. Has a biochemical component to it as well. But you never know when it's going to hit. But the question often is, how much does it impair you? How much does it get in the way of your life? Of course, you're going to feel sad if your dog dies, but do you feel sad to the degree where you stop going to work, or you stop eating, or you're never sleeping, or you're sleeping all the time? Those sorts of symptoms.
So those symptoms are depression related. And how do I know if I'm worried about? Is that bad? Do I need to seek therapy? How do you know, or how do you as a friend know to tell somebody to get some help?
Well, I think the friend is really an important thing, but to have somebody from the outside looking in to say, you just don't seem yourself, and it's been a while since you've been that way. It's not, a couple weeks of not feeling okay, but you've missed work a bunch, or you're sick all the time, or you're sleeping all the time. Again, you might not notice it yourself, but to have that person who cares for you to mention something to you, and then to talk with them about that, to start the process of opening up, which of course is what ultimately therapy is. But, finding somebody to talk to about it can often be very helpful.
Well, when you mentioned therapy and talk,
yeah,
what are some good ways to treat depression?
Well, some is what you don't do. Be careful of eating too much, sleeping too much, drinking alcohol, things like that, things you don't do. Exercising, getting your body moving. There's a tremendous inertia associated with depression, that object at rest tend to remain at rest kind of thing. And it's very difficult, but getting your body moving, that's probably the number one treatment, maybe short of medicine itself, is exercise, getting yourself moving forward.
So one of the things that I worry about depression is it leads to not only just dysfunction, but suicide can come in there.
Yeah, I assess for that, the suicidal ideation. Do you think about death? Do you think about dying? Do you think about harming yourself and things like that? And probably the general public doesn't want to know how often people say, yes, it has occurred to me, or I have thought of that. And of course, then you have to assess how much the intent is. Lots of people have those thoughts, but how deep is that intent, and dealing with it very strongly. You got to take that seriously.
So there's nothing wrong with asking for help.
There's everything right with asking for help. The wrong thing is often the isolation, the hiding yourself out, the staying in bed, pulling the covers over your head and talking to no one, keeping yourself away from people who love you. Asking is absolutely the better thing to do, the healthiest thing to do, and often the safest thing to do.
And for me, faith and church has a little bit about treating depression.
There's no question about it, Jeff. The people who have a strong belief system, who have a sense of their connectedness to larger things, scientifically they do better. I believe it's a spiritual issue as well, but yes, there is a strong component of, if you believe in God or a higher power, a being that's outside of you, that's great and powerful and loving, it helps.
It's great information. If you're depressed, don't hesitate to ask for help. We'll be right back.